Hey there, good morning. This is Justin Lubino again with Senior Advisors. And it's Monday at 10:30, so it's time for our Facebook live session this week on Medicare. And this week's topic for our brief discussion will be what are the high-level differences between Medicare supplements and Medicare Advantage plans. As you can see, we're taking a different format this week. Facebook hasn't figured out yet how to show the video and the slides at the same time. So this week we're going to try and just do the video, and I'll talk to the topic again, which is the high-level differences between Medicare supplements and Medicare Advantage plans. This is our fifth weekly live session. The prior weeks, the first week we did was a high-level overview of what is Medicare. The second week was what does Medicare Part A cover? And the third week we did what does Part B cover? And just last week we discussed what are the Part B premiums and the IRMAs, or income-related monthly adjustments for Medicare. And again, this week we're going to talk about the high-level differences between Medicare supplements and Medicare Advantage plans. One of the things that we do like to start out with on these weekly sessions are a quick trivia question, and we end with one as well. And if you are the first one to answer correctly in the window for the trivia question, you get a $10 gift card either to Starbucks or Amazon. So the first one to type in the answer in the window will get the $10 gift card. So the first question for this week, before we jump into the topic at hand, is what is the most robust coverage you can get right now for a Medicare supplement? So I'm looking for the name of the plan for the Medicare supplement or Medigap plan that's available today that would provide the most medical coverage. This is a letter designated plan, as a little hint. And this plan, if you enroll in it, basically gives you almost basically 100% medical coverage. So the first one to type in the plan name in the window will win the $10 gift card, again, either to Starbucks or Amazon. And we'll give it a minute here for folks to answer. And one other comment as we go through the presentation, looks like Lonnie got the correct answer. Thank you for joining, Lonnie. And that is the correct answer. The Medigap Plan F is the most robust plan you can get today. And basically it covers everything under Part A of Medicare, which is your hospital benefit, as well as everything under Part B of Medicare, which are your doctor's visits, your tests, x-rays, expensive things like chemotherapy, kidney dialysis, etc. Part B will cover the 80%, and then that Plan F would cover the other 20% with no out-of-pocket costs to the individual. So, Lonnie, I'll get in touch with you after the session here to let you know, to get your email address for where we can send that gift card and which gift card you want. So thanks for joining. So let's jump into it. And the way these formats work, the way the format of these sessions work, basically I just go through a brief topic for 3 to 5 minutes. And then feel free to ask questions either related to that topic or any Medicare-related question. You can type it right into the window, and we will answer your questions throughout this presentation. The last couple of weeks, these have gone anywhere from 20 minutes to 30 minutes, the entire session. So today's topic, again, is what are the high-level differences between Medicare supplements and Medicare Advantage plans. So the first difference between Medicare supplements and Medicare Advantage plan is Medicare Advantage plan basically replaces your Medicare Parts A and B. So you're no longer on Medicare Part A from the government, which is the hospital benefit, and Part B, which again is your doctors and everything outside of the hospital, from the government. If you choose a Medicare Advantage plan, it will replace those benefits. So you will no longer use that red, white, and blue Medicare card if you enroll in a Medicare Advantage plan. When you go to the doctor or the hospital, you're just going to give them your Medicare Advantage ID card, and that's going to be your coverage. Whereas a Medicare supplement will supplement original Medicare. So you're still on Medicare A and B from the government, the hospital and the doctor's benefit, and the Medicare supplement will just fill the gap. It'll cover that, that 20%, for example, that Medicare does not cover, and it's just supplementing original Medicare. So that's the first high-level difference. The second is the private network. So Medicare Advantage plans are the fully privatized option, where you're basically you're giving your Medicare benefits over from the government to an insurance company. So now the insurance company is managing your hospital and your doctor's benefits. So you're going to be on their network, that insurance company's network of doctors and hospitals. Generally, most of these Medicare Advantage plans are HMO type plans, where you have to go to their doctors and their hospitals. Some of the Medicare Advantage plans have started to offer PPO, which is an out-of-network benefit. So you can go to other doctors and hospitals. But the majority of the Medicare Advantage plans are still HMO type plans. Whereas a Medicare supplement does not have a private network. With a Medicare supplement, you're still on Medicare's network. You can go to any doctor or hospital in the country that accepts Medicare, which is still 99% of hospitals and 90% of doctors still accept original Medicare. So with a Medicare supplement, you can go to any one of those doctors or hospitals that accepts original Medicare. Referrals. So some of the Medicare Advantage plans will require referrals to see a specialist. However, if you're on original Medicare with a Medicare supplement, you do not need referrals to see a specialist. So that's another difference between original Medicare and a Medicare Advantage. Some Medicare Advantage plans are getting away from referrals and don't require them, but there are some still out there that require referrals to see a specialist. Part D drug coverage. So the drug coverage is generally going to be included with the Medicare Advantage plan, whereas the Medicare supplement with original Medicare, you'd have to get a separate Part D plan, Part D drug plan. There's about 20 to 25 different Part D plans available in each state. So if you went with original Medicare with a supplement, you'd have to get one of those Part D plans as well, where the Medicare Advantage plan would include the drug coverage. All right. The monthly premiums, that's how much you pay the insurance company each month for the health insurance. With a Medicare supplement, the premiums are generally going to be higher than a Medicare Advantage plan. There are some Medicare Advantage plans that have premiums as low as $0 per month for that Medicare Advantage plan. All right, Medicare supplement, you're not going to find one that's $0 per month. Some of the Medicare Advantage plans, though, do have higher premiums. You could have over $200 a month for a Medicare Advantage plan premium, whereas the Medicare supplements are going to be, depending upon where you live, anywhere from $100 a month up over $200, $250 a month, depending upon your location and which plan you end up selecting for a Medicare supplement. So you're paying more in premium for those Medicare supplements. But the other difference at a high level is the out-of-pocket exposure is going to be higher with a Medicare Advantage plan. The federal limit for out-of-pocket exposure is $6,700 for a Medicare Advantage plan. So if you get sick with a Medicare Advantage plan, you would have to pay co-pays and co-insurance, depending upon the plan you enroll in, up to $6,700 per year in medical costs. With a Medicare supplement, the out-of-pocket exposure is minimal. It could be zero with that Plan F that Lonnie answered correctly earlier. The out-of-pocket exposure is zero with a Medicare supplement Plan F. There's a few other supplements out there that are becoming more popular that have less than $200 out-of-pocket exposure. So bottom line is the premiums are generally higher with a Medicare supplement, but the out-of-pocket exposure is much lower with a Medicare supplement versus a Medicare Advantage plan. All right. Guaranteed renewable for life. So Medicare supplements are guaranteed renewable for life. So once you enroll in a Medicare supplement, as long as you're paying those monthly premiums, you can never be kicked out of that Medicare supplement. Regardless of your claims, regardless of anything, as long as you pay those premiums, you're going to keep that Medicare supplement for life. Medicare Advantage plans, however, are going to change every year. So those are calendar year plans. They change once per year. Between October 15th and December 7th is your one opportunity to review and change a Medicare Advantage plan for the following year, because those plans do change annually. Let's see here. The other change, some of the Medicare Advantage plans have other benefits such as dental, vision, or hearing. They may offer a cleaning or two for your teeth for the year, or some sort of discount on a hearing aid and that sort of thing. Those things are sometimes covered with Medicare Advantage plans, where they would not be covered with a Medicare supplement, because Medicare supplement is just supplementing original Medicare. So at a high level, those are the main differences between Medicare supplements and Medicare Advantage plans. There's a lot more detail when you start diving in, because every carrier has different Medicare Advantage plans in each service area, so it really depends on where you live as far as the options that are available. But I just wanted to touch on at a high level, what some of those differences are. This is the third biggest mistake we see people make on Medicare, is not fully understanding the difference between Medicare supplements and Medicare Advantage plans. So we hope that this part of the session was helpful, and that you have a better understanding now for Medicare Advantage versus a Medicare supplement. I'll leave it open for Q&A. Any questions you can just type in the window. Again, it can be related to Medicare supplements versus Medicare Advantage, or just any Medicare related question. If you have, you can type in the window. Okay, Claudia asks, when you turn 65 and sign up for Medicare and your spouse is 64, how do you cover your spouse for a year until they turn 65? Okay, this is a pretty common situation where we have two different aged husband and wife, and one of them is aging into Medicare and the other is not yet able to get Medicare. So it really depends on what your current coverage is. My assumption with your question is that you're currently covered on a group health plan of some sort, and one individual, maybe the one that's working, is going to be aging into Medicare and dropping that group health plan. If that is the case, then my recommendation in almost all situations would be for the younger spouse to get COBRA. For up to, they can actually get up to 36 months of COBRA coverage if you're aging into Medicare, 36 months from your 65th birthday, essentially, or the birth month. You get 36 months for the spouse. So that could be one potential option for the situation, Claudia. Another option is the individual market, and you get an individual plan for the 12 months, but that market has gotten very expensive and the coverage has gotten much worse. It's got higher deductibles and higher out-of-pocket exposure over the last several years. So it's probably going to be better for the spouse to take the COBRA coverage until they turn 65 in that situation. I hope that helps, Claudia. The next question is from Richard or Clem here. Does the guaranteed renewable apply to Medicare Advantage? In other words, can you be dropped or denied? Okay, so for Medicare Advantage plans, there is no medical underwriting. Okay, so what that means is every year between October 15th and December 7th, you can get into, if you want to get into a Medicare Advantage plan, you can do so with no medical questions asked. So basically anyone can get into a Medicare Advantage plan. The one exception, however, is kidney dialysis, or ESRD, end-stage renal disease. If you're on kidney dialysis, that's the one medical knockout for a Medicare Advantage plan. But outside of that, basically anyone can get anyone who's Medicare eligible on A and B of Medicare can get a Medicare Advantage plan during that October 15th to December 7th period for the following January 1st effective date. But your question about guaranteed renewable, no, the Medicare Advantage plans are not guaranteed renewable because they're only guaranteed for that particular year. So the coverage you enroll in for 2018, for example, may or may not be available in 2019. The plans change every year for Medicare Advantage. The premiums, the copays, deductibles, the networks, those Medicare Advantage plans are not regulated in the same way as a Medicare supplement, which is federally regulated coverage that will never change. For instance, that Plan F we described earlier for Medicare supplement, it's basically covers everything under Part A and B of Medicare. That plan will never change for Medicare supplement. Medicare Advantage, those plans, again, they change every year. So that plan may or may not be available the following year, but there's no medical questions to get into a different Medicare Advantage plan that following year. There are medical questions to switch Medicare supplements. If you want to switch Medicare supplements, you can do that anytime throughout the year. However, if you're past your 6 months Medigap open enrollment period, there's medical underwriting for Medicare supplement plan enrollment. So, all right, Richard, so does that mean they cannot ask your medical history? For a Medicare Advantage plan, that is correct. There's no medical questions on the application except, again, the ESRD question related to the kidney disease is the only real medical qualifier for a Medicare Advantage plan. Your next question is, can they ask you each year your medical history and base the fee upon this? No. No, the answer to that is no. For a Medicare supplement or a Medicare Advantage plan, the premiums are set for everyone who enrolls in that plan. So there's no premium based upon your specific medical claims. The premiums are everyone who enrolls in this particular Medicare supplement, in this area, with this, age, and then there's gender-based pricing, male, female in some cases, are going to pay the exact same premium, regardless of your claims history. With a Medicare Advantage plan, it's not even gender-based. It's really just service area-based for this particular area. And there's no age-based pricing either for Medicare Advantage. For this particular area and this Medicare Advantage plan, everyone that's enrolled in it pays the same premium. All right. I hope that helped, Richard, with your questions. Elizabeth, how big are the networks in a Medicare Advantage plan? Well, it really depends on the insurance company that you're enrolling in that Medicare Advantage plan with. There's some that have very narrow networks that you can be restricted to a particular service area of doctors and hospitals, and you can't go outside of that area. If you want to go to a specialty hospital like a Sloan Kettering or a hospital of special surgeries in New York or the Johns Hopkins or the Mayo Clinic, there's certainly Advantage plans out there that don't allow you to go outside of your service area. There are others, however, that have started to offer a PPO benefit, which is basically an out-of-network benefit that allow you to go to doctors and hospitals that are outside of your network, outside of your service area. And in those cases, most of the plans we've seen have a higher out-of-pocket cost or maximum for those out-of-network plans, like a $10,000, for example, out-of-pocket maximum if you go out-of-network versus $6,700 out-of-pocket maximum if you stay in network. So if there's any other questions out there, you can type them in the window. And while we're waiting for more questions to come in, I'll ask the other trivia question for today. Again, the first one to answer in the Facebook Live window with the correct answer will win a $10 gift card, either to Starbucks or Amazon. So our second question today is, what is the out-of-pocket maximum on a Medicare Advantage plan? And this is for in-network purposes, the federal out-of-pocket maximum, the most you can pay for your medical expenses out-of-pocket with a Medicare Advantage plan. The first one to type that number in the window will win the $10 gift card. And also feel free to continue to type your questions in. If you have additional questions related to Medicare, we can certainly answer those here. And Richard has the correct answer. So the correct answer for the out-of-pocket maximum in-network for a Medicare Advantage plan is $6,700. So if you have a Medicare Advantage plan, the most out-of-pocket exposure that you can have in-network, this is a federal limit, is $6,700. Mary, thank you for your answer. The 183 is actually the Part B deductible, so that's a different value. But Richard got the right answer, which is if you enroll in a Medicare Advantage plan, the $6,700 is your total exposure. Mary, your answer would be correct for a Plan G Medicare supplement. The most out-of-pocket exposure you have with a Plan G Medicare Supplement, which is a completely different type of plan than a Medicare Advantage, is $183 this year. So, Richard, your question, I assume the $6,700 is annually. Yes, the out-of-pocket maximum of $6,700 is a calendar year maximum out-of-pocket. So if you get a Medicare Advantage plan, the most out-of-pocket you could have in a calendar year is $6,700. So worst case, if you get sick in November, December, and you have to have treatments, a lot of these plans require you to pay 20% for something like chemotherapy or kidney dialysis. You may have to hit the $6,700 in November, December, and then your out-of-pocket would reset in January, and you'd have to hit the $6,700 again in January or February if you're having treatment. So that's how the $6,700 works, Richard. All right. Any other questions out there? Feel free to type them in the window, and we'll answer them here. And just to let everyone know, we do have the prior videos are on our YouTube page for senior advisors. You can subscribe there and see our prior Facebook Live sessions. You can go to our Facebook page and like us or follow us, and you will get updates in the future as well. Our website has a lot of videos out there, senior-advisors.com, with a lot of content related to Medicare, and we do a free Part D analysis for the drug plan. You can do that on our website as well. And there's just a lot of other content information out there related to Medicare. All right. I'll give it one more minute here and see if there's any other questions, and then we'll wrap up for this week. All right, we're going to wrap it up here. Everyone in the Northeast, stay cool. It's hot out there today. And if you're watching the World Cup, enjoy it. And we'll be in touch. We'll be in touch next week at the same time, 10:30 on Monday. And next week's topic, what is next week's topic? We're going to be discussing the Medicare Part D and the donut hole. So we'll be in touch next week at 10:30. Thanks, everyone.